My name is Anna Lyons, and my project is entitled Baseline Distress and Adherence to Adjuvant Endocrine Therapy. My project mentors are Dr. Catherine Flint and Dr. Joe Neuner. Adjuvant endocrine therapy, or AET, is part of the standard treatment for women with hormone receptor-positive breast cancer. However, approximately 1/3 to 1/2 of patients either discontinue their medication or take fewer than 80% of their prescribed pills. Both side effects and the costs associated with medication have been previously described as barriers to AET adherence, but the association between these two factors has not been described. As the breast cancer population ages and increases in size, better methods are needed to identify those at high risk for AET discontinuation and understand their barriers to treatment. As such, my research question is, how do older women treated for breast cancer describe the side effects attributed to adjuvant endocrine therapy and the cost of managing symptoms? This work is part of a larger quantitative study to examine whether patient-reported distress at AET start is associated with early discontinuation. A qualitative study was designed to provide context for these results and to better describe the relationship between side effects, the cost of managing side effects, and AET discontinuation. In terms of methodology, eligible participants were drawn from the Frater MCW Cancer Center Registry, oversampling for Black patients. The distress thermometer, or DT, is shown above. The DT score prior to AET start was utilized as a self-reported marker of patient distress. Study participants were stratified into 4 groups: high versus low DT score prior to AET start, and self-reported AET adherence versus discontinuation. Interview guides were developed for both adherent and discontinued patients, with major topics including cancer treatment, beliefs about medication, side effect burden, costs associated with taking AET, and management of associated side effects. To date, 21 interviews have been conducted, audio recorded, and transcribed. If you turn your attention to the results section, you can see some of the themes that have come up prominently in our preliminary interviews, including trust in healthcare team as a motivator to take AET as prescribed, decreased quality of life due to AET side effects, anxiety about treatment ending and fear of cancer recurrence, medical and non-medical approaches to managing side effects, and the financial burden of managing side effects. What I hope that you can appreciate here is that there is a wide array of experiences on these medications, and many factors contribute to the decision to adhere to medication or discontinue. I've highlighted some of the more illustrative pieces of the quotes and will leave a short period of time for you to read these quotes. As you can see in the bottom and far right quotes, the financial burden of managing side effects has presented in different ways. Women have primarily cited that the cost of managing side effects is not burdensome to them. However, one participant did cite the cost of managing side effects as a factor in her decision to discontinue. Based on work done thus far, we can preliminarily conclude that women who are prescribed AET weigh medication disadvantages with perceived necessity when deciding whether to adhere to or discontinue treatment, and their healthcare providers play an important role in helping to manage side effects. While not a common experience amongst those interviewed thus far, one patient who discontinued AET described the financial burden of managing side effects. Moving forward, we will conduct up to 19 more interviews with interim analyses to look for thematic saturation, suggesting that all key factors have been reported in our interviews. We will complete codebook development and analysis to compare relevant themes across our 4 study groups. I will identify and summarize the ways in which the cost associated with managing side effects is discussed amongst participants. And finally, results may aid in the development of pragmatic interventions to better identify and counsel those at risk for non-adherence. This work was supported by the National Institute on Aging Training Grant, as well as Dr. Neuner's R21 grant, Baseline Symptoms and Adherence to Oral Breast Cancer Therapy Among Older Women. Finally, we would like to thank our study participants for their time and essential contributions to this project.